This
Yes.
conference will now be recorded.
Start now.
Hello, I'm Shagufta. I'm read the scenario and I'm ready for the structured discussion.
Okay, so did you read the scenario? Can you summarize the scenario to me?
So this is a case of probable postpartum voiding dysfunction, and in a private gravida who delivered a macrosomic baby with assisted vaginal delivery, that is forceps. So I would assess this patient by taking a history, examining her notes, and also her. I would examine the patient also, and my recommendation will be based on my assessment findings.
Okay, so when you read the scenario, what is coming in your mind? What is the most probably the diagnosis for this case?
So this is a probable case of postpartum voiding dysfunction.
It is again
This is a case of postpartum voiding dysfunction.
postpartum voiding dysfunction. Okay, and how to manage this case?
So this case, first of all, I would go to the patient and I would go to the patient. I would explain my role to her. I would take her consent. And this patient, first of all, I would introduce myself to her and then I would check her identity and I would like to examine this patient. First of all, I want to know whether she is comfortable enough to answer my questions. And if she is not comfortable enough, then first of all, I'll address her pain relief. I would give her analgesia. And also, if she's in pain and she's not able to pass urine, then I would insert an in and out catheter to relieve her of her pain. Then in her history, I want to know because I can see that she delivered a 4.5 kilogram baby through forceps. So I want to know about, I want to know about the delivery. I can see that she was an epidural, which is also a risk factor for postpartum voiding dysfunction. And I want to know whether she had any problem, any tears during delivery, any other problem during delivery. I can see that she had a prolonged labor. So, what was the prolonged second stage? So, so what was the reason? I want to know. Uh, I want to know about more about her delivery, and also I want to know. Then I want to know about her pregnancy. I want to know whether she has had similar urinary complaints during pregnancy also, and whether she had any other problem during pregnancy, like whether she had any retention of urine during pregnancy also, I want to know about that. Then I want to know about her pregnancy. I want to know whether she has any comorbidities, like whether she is a diabetic because she gave birth to a macrosomic baby. So I want to know about that. Then also I want to know whether she has any allergies, especially latex allergy. I would, before inserting any catheter, I would rule out latex allergy and put the catheter. And then I want to know whether she has any history of any recurrent urinary tract infections. And I want to know her BMI and also her blood group to know more about her. Then this patient, I would access her notes of her pregnancy and also her delivery notes and check whether there was any trauma during the delivery, whether she has any perineal tear or any vulval hematoma or which was managed and whether what was the estimated blood loss during delivery, that also I want to know from her notes. Then I would examine the patient in the presence of a chaperone. I would do a head-to-toe examination. First of all, I would look at her general examination to rule out any pallor. Maybe she had a concealed bleeding, maybe a vulval hematoma. So I want to rule out that. Then I would examine her perabdominally and especially look for palpable bladder in this patient and what is the uterine size. And also then I would examine her local examination to look out for any vulval tears, vaginal tears, or genital examination if she allows me to do so, to look for any cervical tears and or any hematoma. So
Yes,
so this is what I want. Um,
yes. This is And after that, do you have anything you want to add for the management?
So
Now
the
you're
management in this case,
yes.
I would, after ruling out any allergies, I would insert a catheter in this patient, which will
Mhm.
be an in and out catheter, and the size
What is the type
because
of
she, I mean,
catheter? What is the type of
pardon?
catheter? What is the
It
type
will be
of
an
catheter?
yeah, it will be an in and out catheter,
In and
and the
out.
size will be 12 French, and
Mm,
the catheter can be latex or silicone, and I will insert it after ruling out any latex allergy.
mhm,
And I would insert the catheter and I would measure the voided volume. If the voided volume is more than 500 ml, then
mhm,
I would need to keep the catheter for another 24 hours. And if the I would need to keep the catheter for another 24 hours. If the voided volume is less than 500 ml, then
mhm,
I would need to measure the post-void residual by doing an ultrasound scan. And
mhm.
if the post-void residual is less than 150 ml, then I don't need to do anything unless and until again she complains of urinary retention. And if the post-void residual is more than 150 ml, then again I would go for catheter for another 24 hours.
Okay, so after that, also after 24 hours, she comes voiding and come past urine. What can you do?
So after 24 hours also, after removing the catheter, if she is not able to pass the urine, then what I'm going to do is again I'm going to measure the post-void residual, and if the post-void residual is more than 150 ml in this case, then I would advise the catheter to be kept for 1 week.
Mhm,
And the patient would be taught about catheter care, and also if she is discharged home with the catheter, then we will teach her about the catheter care, avoid kinking, and keep the area, I mean vulval area clean, so that she doesn't infect herself. So all this would be taught to her before if she's discharged home with the catheter.
yes. So, from the case and from the history, can you tell me what is the risk factor that the woman has to have postpartum voiding dysfunction?
Yeah. So the risk factors are, first risk factor which I can see that she is a primary gravida.
Mhm,
The second risk factor is macrosomic baby. Third
mhm.
risk factor is she had a prolonged second stage of labor. Fourth
Yeah.
risk factor is she had an forceps delivery. And the
Mhm.
fifth risk factor is she was on epidural.
On epidural. Okay.
Yeah.
So, for this, can you tell me what is the future complication that could happen?
So in this case, the possible future complications which can happen is that she can have long-standing voiding difficulties, like she can have hesitancy, dribbling, poor stream, and also she will be required she can be straining during to pass her urine. Then the second complications, long-term complications, can be that she can have recurrent UTI. Then the third one would be that because of this recurring UTI and because of the long-standing pressure changes, there can be hydronephrosis and there can be renal damage in the long run. Then also she can have incontinence, especially overflow incontinence.
Okay, now you have 1 minute extra. So, do you have anything you want to add?
So in this case, if this woman is not able to pass urine even after 1 week, then we will manage her in a multidisciplinary team, and the multidisciplinary team will consist of the urogynecologist, and also we may require the opinion of a neurologist also, because I mean postpartum voiding dysfunction can be due to atonic bladder, and the atonic bladder can be due to probable nerve damage during the delivery, the prolonged second stage and the forceps delivery, and also there can be some problem with the um, perineal muscles, so we need to involve a neurologist and a urogynecologist, a physiotherapist, and also the consultant gynecologist. and so all these people will be involved in her care.
Okay, thank you, Shagufta.
Thank you, Dr.
Um,
Thank you,
he
Dr.
was
Sam.
brilliant, brilliant. So you cover everything and you manage everything, and most of the point is okay. Just when I ask you about what is the possible diagnosis, I prefer here to put a differential diagnosis in reality from easy to bad. I know it is post-voiding dysfunction, but it could be hematoma, it could be atony, it could be dehydration by itself. Before examination, you don't know what happened. Okay, I know it is. All of us we know this case is post voiding exam, but in the exam they need to hear the differential diagnosis for this case. I think this is the only point. Otherwise, the differential diagnosis you mention it in the when you explain like hematoma, lose, missing back, attorney, all of them you mention it during explanation. However, I prefer that when they ask you about what is the diagnosis, don't give the diagnosis directly to him. Tell him it is most probably it will be, but could be blah blah blah. The differential diagnosis is very important in the cases when you explain, because still you don't examine her, still you don't see, for example, any examination she may need others. Do you understand me? Okay,
Yes, doctor,
otherwise,
you're right. Yes, I should have gone with the differential diagnosis. That's right.
yeah, otherwise you were brilliant. This is the most question they will ask you in this case. Summarize the case. What is the diagnosis? What is your immediate action? You fantastic, was fantastic when you ask. I want to see her initially if she can come with me and chat with her, or she's still in pain and she want to get rid from her symptoms. So in this case, we must relieve her symptoms. This is the important than taking a history and others. Even you can take a quick look to her notes to know what is the possibility of her condition. What is the type of catheter? You mentioned it very well that it is could be it is 12 inch and latex or silicone. If she is not allergic to latex, this is also a good point. This is a patient safety, and you mentioned it very well. How long you recommend to leave the catheter? Here also you cover it very well that it's according to the residual volume, if it's more than 150 or less than 150, and how you mention it. This is according to this slide. This slide this slide in reality is the answer of this question, and all of us you must take a look about it and you must know about it. It is important that if it more, if it whether by a scan or by the volume you drain, if it more or less than 500, as you mentioned, if it less than 500, so after voiding you just take the residual volume. If it more than 150 and the volume in general more than 500, it must be under a catheter for 24 hours. And after that, you must remove the catheter and give her to void by herself. If it void and everything is okay, also you measure the residual volume. But if she can't void by herself or the residual volume is more than 150, so you must keep it for 100. Another thing I want you to mention it also the communication with a colleague. Here it's preferable to interfere with the urogynecologist consultant and inform him in this condition. So here, when you mention these, it will be a communication with a colleague. So he will put tick from the beginning. Everything was brilliant, and this is the most important answer for these questions. The risk factor, you mentioned it very well. The epidural use is very important cause and very important to make a bladder paralysis sometime, and this action could take with the patient from 24 hours to 48 hours, and it's relief after that. The immediate action was brilliant, and the future complication, all of these points you cover very well. So we will take now the second uh, who's
Thank you, Dr. Samar, for letting me perform. Thank you.
yeah, thank you. So who's Regina? You told me that you are in February, isn't it? Regina, hello? Who is in February? Hello, all of you. Who is in February?
Yeah, hello, I am in February.
Okay, yeah, Regina. Regina, isn't it?
Rajini.
Okay, so take the second case. Yeah, start the 2 minutes now. Yes, Regina, you can start now.
Yes. Hello, I am Dr. Rajni, one of the doctor in the clinic today. May I confirm your name and age, please?
I'm Catherine Moby, 38 years old.
And how would you like to be addressed?
Catherine, please.
Catherine, I understand that you have some lump coming down and you are here to discuss about that. Am I right?
Yeah,
Before we discuss on management, can I ask you a few questions to know you better?
yeah, of course.
Okay, so Catherine, can you tell me more about your problem?
Um, um, More than 3 or 4 months ago, I start to feel that there is something a dragging sensation and something is wrong. And I feel that I have, and this condition worsening with time. I feel that I can't empty my bowel when I have a bowel motion. And sometimes I try to use my digits to empty my bowel.
Mm-hmm. Okay, and did you try anything for that?
No, I went to my GP and I went to my GP, and after that uh, he told me that it's a problem can go with time, and he gave me some exercise and others. I have a leaflet regarding these, but in reality it doesn't work, and I feel my symptoms worsening with time.
Oh, I see. And do you have any problems with like
Like what?
cough? Any problem?
Oh,
Any
cough.
long-standing cough?
Um, no, I don't have anything.
And are you constipated?
Uh, Sometimes I feel difficulty to empty the bowel. This is the reality. However, I go to the toilet daily. but sometimes I need to go
Okay.
more frequent. But it is not constipated or not watery loose. But because I didn't I can't feel that I empty my bowel.
Oh, I see. And what is your job? Like any heavy lifting, anything?
No, I'm a teacher.
Okay, right. All right. And can you tell me about your periods, how it is?
Regular.
Okay, when was the last period date?
7 days, 8 days ago.
And what do you use for contraception?
Condom.
Okay, and um, do you follow your GP for any medical illnesses?
No,
Any surgeries?
no.
You have two cesarean section. Beside that,
Yeah, I have two cesarean sections. My daughters with cesarean section. One of them 5 years ago, and the other I think 7, 8 years ago.
okay. And how was your cesarean? And did you face any problems after or during cesarean sections?
No,
Okay, okay. Any allergies you have?
um, no, I don't have allergy.
Any family history of concern?
Not reality.
Okay. And do you have do you, some questions about your habits? Do you smoke?
Yeah, I smoke
How many cigarettes?
around 20 cigarettes a day.
Oh, that's too much. And did you think of quitting any time because it's not good
Oh,
for
I
your
try,
health?
I try, but it doesn't work.
Oh, but sometimes this can also lead to problems like cough and worsening of your symptoms. So if you are not able to do it by yourself, we have NHS stop smoking services. And if you think I can uh, connect to them, what do you think?
Yes, please. If they can help me in this issue, yeah, please.
Yes, yes. So that I will do. Okay. And any alcohol use?
Occasionally, just in the weekend or when there is a social party
Okay.
or something like that.
Yeah. Any drugs for fun?
Any what?
Drugs, recreational
No,
drugs?
no, no, no.
Okay, good. So, how is your mood nowadays?
It's good.
Yes, okay. And about your height to weight ratio?
Uh,
Yeah,
it
I
is
see
around
it's your
39,
BMI is
and
39.
yeah, yeah.
Yeah, did you try anything for reducing your weight? Did you do any diet or exercise program?
I try many times, but it doesn't work.
Oh, I see. Then you may get help by talking to dietitian. I will try to connect you to them. So because it may help in talking to them, right?
Yeah, I will be thankful for that, but because my mom like these, my sister like these. But if it worked, that's fine.
Yeah, yeah, we will do that.
Yeah, I hope that I
Okay.
can, but I'm frustrated from it.
Yeah, yeah. Okay. So, Catherine, I would like to examine you in presence of chaperone, if you allow me.
Yes.
Any examination findings?
It is type 2 posterior wall descent.
Okay. Okay. So, Catherine, after examination, I have found that you have uh, um, you have this your vagina is loose and your back passage vagina is coming down. We call it as posterior wall descent rectocele. Am I making sense to you? Am I clear?
What is it exactly? I can't understand what's the meaning of these.
That means your back passage through vagina is coming down. It has little loosened up and it's coming down.
And why that happened?
There could be many reasons, but in your case, maybe it's because you have constipation, or maybe because you smoke, or because of your weight.
Hmm.
Okay,
Okay.
so
Yeah.
yeah, so what will we do? I will offer you a appointment with dietitian,
Mm-hmm.
so that first of all we can try to do some weight reduction, right? Like modify your diet and include some exercises so that we are able to lose some weight. Will
Yeah.
that be fine with you?
Yes.
Yes, and then second thing, we also want to work on quitting and reducing smoking, right?
Yeah.
Yeah, and then I will put you in touch of physiotherapist, and who is a doctor who will specialize, who will teach you how to do pelvic floor muscle exercises. We call it as pelvic floor muscles, so that your muscles in down vagina are getting stronger.
Okay.
Okay,
So,
so
and
yeah.
what do you mean by these exercise? And
So this will include squeezing of your back passage,
mm-hmm.
and then squeezing and relaxing. This we will recommend you to do at least 8 squeezes 3 times a day for at
Yeah.
least 16 weeks.
Mm. Yes.
So I will fix an appointment later on again to review your condition, whether these things have helped or not.
Okay. So, and if it not help, what is there is any other treatment? So, can I take it, or it can't help?
Uh, Yeah, if all these will not work,
Mm-hmm.
then we might offer you surgery. But before that, we will try to do this all these things. Okay.
Yeah. Yeah.
Yeah. So I will write back our discussion to your GP, and I will give you this information leaflet to read more about.
Mm-hmm.
And here's support group. I will fix an appointment with dietitian, and
Mm.
I will put you in touch of NHS Stop Smoking
Okay.
Services. How? Okay.
My friend using something like ring and pessaries. Hopefully it work
Yeah,
with me.
yeah. That option is also there. So yeah, we can offer that also.
Mm. Continue.
Sorry, I
Continue.
we will offer you this pessary, and for 6 months, we will teach you how to put clean, and we can try this 6 months whether it's working or not. Every 6 months, you need to change it.
Okay. Thank you, Regina.
Thank you.
Thank you very much for the for everything. Look, now we will start with the history. The history is brilliant. However, all the Urogyne cases, you must cover in the history the most important point. You must ask about the current complaint, how long you have suffered from it. You did these. Asking about the bowel habit, you did also. But it's important to ask about the urine work, as if there is any
Yeah.
leaking, did you rush toilet, you forget these. You didn't ask about the partner, with whom did she live, about the sexual life, is it interfere with her sexual life or not, because also this is important. If it interfering with the sexual life, so this is a big problem, can lead to domestic violence. If there is any domestic violence, okay, because she has a bowel habit, you ask about the psychological problem, which is very, very important. Okay, you ask about it. So you missed the urine water work questions and the sexual work questions. The most important in urinary, asking about the current complaint, about the the water work, the bowel work, the sexual life, and about if there is any bleeding, if there is any vaginal discharge, if there is how long you have been with your partner, because if she told you I'm long time with him, that's you by these exclude the sexual transmitted disease. However, if she told you with him 6 months, directly you must ask her about Do you have any sexual infection disease? Or have you ever had? You must ask them in politely way, of course, especially in the
Yes.
sexual
Okay.
life. Directly when you ask about the sexual life, whatever the question, give her the sentence before. Um, I know talking about sex is something embarrassing. However, I must ask you these questions. Have you ever had any sexual, any difficulties during sexual act? Because we have lots of scenarios like dyspareunia and other, we must ask. So touch these points, please. It's important. This is in
Yes.
the
Yes.
history. The smoking you cover it very, very well. In the examination, you take a permission to examine her in the presence of the chaplain, and after it contained, you must hear, tell her, I will examine you. I will take blood pressure, pulse rate, respiratory rate, as well as I will examine your chest to see if there is any problem with the cough. I will examine your abdomen to see if there is any lump or swelling or any pain. I will examine you from down below to see the healthiest of the neck of the womb and the healthiest of the vagina as well. May I need to take a vaginal swab? And and to see if any descended or if there is any bulging. After that, the examiner will give you the results of the examination. Because you are online, so the examination will be with the questions. When you read the question, the second, please, anyone will be on the online. The first thing you will see at the first paper, at the right end, there is the number of the pages. So when you see it is two, that means there is another pages. Don't forget to read it. The second page, always there is a results of the examination to protect you from examining this patient. Okay, because it's
Okay.
online, so it will
Okay.
be difficult to examine her. So don't forget to see the second. I know here because I didn't put the examination. You ask about it, which is very nice. But if you didn't found the examination, you must at the end tell her, I will examine you generally, abdomen, and from down below, all the gynae cases.
Okay.
It's clear?
Yeah.
Okay. Now, about the explanation, all urinary stress incontinence, overactive bladder, mixed, the prolapse in general, whatever the prolapse, prolapse, or tell her like these about the explanation. As you know, the pelvic organs is bladder, uterus, and the bowel. All of them are supported by muscle and supportive tissue. With the time, because of deliveries, because of the time, something because of the for any reason, these supportive tissue or these supportive organs will be weakened. So this can happen, whether anterior prolapse, whether posterior prolapse, whether vault prolapse. So with the weakness of these, this problem can happen. So in 1 minute, less than 1 minute, give her the explanation. Don't let her to ask you why that's happened. This will take time from you. From the beginning, you give her the diagnosis. You told her posterior. You can't tell like that. What I found from the information in front of me, I can found that you have posterior wall prolapse. Do you hear about it before? She will tell you, no, what is it? Directly give her the explanation. So in 1 minute, so you finished on time, but because I want to give you some hint point that give you a good mark. Okay.
Yes.
Now about the MDT, which is fine, dietitian, and later on in the surgery, she will go to the rectal surgery. We will have rectal surgery, the smoking services, which is nice. About the lifestyle modification, you must important points that the diet, the type of the diet, it must be with the laxative, biofeed, some fibers, because you want her stool always be loose. That's help
Mm.
her
Okay.
to not put a strain for the back passage. Okay.
Okay.
Otherwise, okay. Another thing what I want to mention, the pessary. The pessary doesn't use in the posterior, and they will
Okay.
ask you if you want to mention pessaries. You tell her it doesn't work with the posterior, and let's help you. If if it is associated with the anterior prolapse or little bit vault prolapse, or little bit stress incontinence, it can help. However, posterior wall alone, pessaries doesn't work. And always they will ask the posterior prolapse, they will ask you, my friend take a pessary, so is it work or not? So you must tell her your friend maybe not the same condition, and here the pessaries doesn't work. You mentioned the surgery in a good way. You didn't mention what is the surgery because she didn't have till now the pelvic floor muscle exercise, which can help. Another point I want to tell you about it, because she's 38 now, isn't it? Yes, 38.
Yeah.
Uh, when she told you about when you told her about the surgery, you must mention a family wishes. Did she need kids more because
Hmm.
you did a surgery for this patient? Another other
Hmm.
thing, that you think that type 2 needs surgery? I don't think so. However,
No.
if it doesn't work, it could be. Maybe this is consultant opinion, not me and you, isn't it?
Yeah.
Not
Right. Right.
ST5. It's not ST5 decision. So you must mention the family wishes. This is what I mentioned. It's present in the front of the examiner. He will directly want to tick after tick after tick after tick. This is important. Any operation in the vagina, you must ask about the family wishes, because if she need, there is, even so she has two cesarean section, she will do the third cesarean section. I know, but in general, sometimes there is no cesarean section, so she need
Hmm.
more babies. Is it clear?
Yeah. Clear.
Any question from others? Any feedbacks from others? Okay, so we will go to the third. Who is in February more? Who is in February? So, who need to take the third cases?
I I am
Uh,
available.
I can take it.
Aina? Aina.
Yes, 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 yes.
Okay, good. Take the third cases.
Okay.
Yeah, start 2 minutes. Okay, good. Start the 10 minutes.
Okay. Hello, I am
Start.
Aina, one of the doctors in the clinic today. May I confirm your name and age, please?
I'm Sarah Robert, 32 years old.
How would you like to be addressed?
Sarah, please.
Sarah, how do you do?
I'm fine.
As I understand from your notes that you are bothered by a lump in the vagina, which is since 3 months, and it is cystic, and you're feeling pain since 3 weeks, and you are here to see your management for that. Am I right?
Yeah. Yeah, yes, please.
Sarah, may I know your concerns and expectations from today's meeting?
In reality, I have this lamp long time ago, but I can't. It was on and off, and I think it was smaller than these. However, it's with time become increase in size, and these days I feel that there is some pain, an irritant pain, and it is discomfortable for me. So please, I want to know the results of the GP told me that it's this need to a surgery, and I don't know exactly how. In reality, I am disappointed when he told me something like that. Is it a cancer? Is it something he didn't answer me about these?
No, no, Sarah, please don't think in that way. It's not a cancer. But first of all, I want to tell you that since consultant is busy and he is not available now, is it okay for you to I take the consultation on his behalf?
Yeah.
Mm. So can you tell me more about this pain? How did it start?
Um, I don't know. It's reality. I don't know exactly when it was with me, 1 year more or less. However, last 3 months, I feel that it is start to become bigger, and I ignore it because there is something. I thought to myself maybe because of the deliveries or the age or something like that. But 3 or 4 weeks ago, I start to have a pain and in this area, and sometimes discomfort me, especially when I sitting. Sometimes it's embarrassing me because of this pain. It is not easy to have a pain in front of. I'm a working a teacher, and it is sometimes embarrassing me.
Yeah, I can see it must be very difficult for you. I'm sorry to know about your pain. How about your water work?
It's okay, but I feel that I go to toilet more frequently, and sometimes when I go to the toilet, there is some pain during pass when I pass the urine, and I feel that I can't complete urination easy. When I go to toilet, I can't finish, so I try to go another time.
Mhm. You bothered by taking antibiotics, Sirkar? You need to take antibiotics frequently to treat your waterwork infections.
What happened? My GP did a urine test maybe 2 or 3 weeks ago, and he found out there was. He told me there's a mild, simple infection, and he gave me antibiotic. In reality, the pain is better now. However, the discomfort and the irritant pain that I have, it doesn't go.
Sorry to ask you some personal questions. Do you leak anytime you found do you leak urine by coughing or by
Um,
sneezing or by doing some?
Yes, with this time, yes. I feel that I leaking some, especially in the last month. I feel that's more frequent.
You need to rush to go to toilet.
No, but I told you
How about the back
I
passage?
go to toilet more frequent. I don't know why.
Mm,
I think because of the infection, but the GP told me
mm.
no, there is something. I want to know what is it exactly.
Any difficulty in opening your bowels?
No.
Please, can I ask a personal question?
Yes.
Are you with someone now?
Yeah, I lived with my partner a long time ago. He's my husband.
Any difficulty in having sex?
Um, Not really, but I want to tell you something that I have during the sexual act. I have some difficulties, especially at the beginning. There is some pain, and I'm leaking urine if there is a sexual act, and also that's
Mm,
making burst in front of him.
I'm sorry to know about this. Any abdominal discharges? Any
No,
bleeding after
no.
sex? Mm. Uh, I can see you have two kids both delivered vaginally.
Yes.
Everything was okay, okay. Any difficulty in vaginal delivery? Any
Yeah.
difficulty in after delivery?
Yes. Everything is okay.
Your periods, please tell me about more your periods.
The period is regular.
When was the last one?
Um, Maybe 10 days ago.
If ever you were screened for any sexually shared infections?
And everything is okay. I don't have any sexual infection.
How about your smears?
It's normal and update.
You have any health condition for which you are following GP?
No.
Any operations you did in your tummy or in your pelvis?
No.
Are you currently taking any medications?
No.
Any allergies you have?
No.
What about your weight and height ratio?
It's normal. I think it's 30. It is 25, 26.
What is your blood group?
Um, B positive.
Please don't mind me asking personal questions again. Do you smoke?
No.
Any alcohol?
No.
Any recreational drugs?
No.
You are a teacher and you are living with your husband. Is everything fine at home? Is
Yes.
partner supportive?
Yes.
If ever, if ever you feel down, depressed, low, lack of interest in doing things,
Everything is okay.
anything significant in the family that I should know?
No.
Anything else you want to add?
Thank you.
Sarah, now in presence of chaperone, with your consent, will examine you. The nurse will check your weight height ratio, check your pulse, blood pressure, temperature. I will
Yes.
examine your tummy for any lumps, if any palpable bladder. Then I will examine you from lower down to see any discharges, any abnormal bleeding, and I will see what is this lump, what it looks like. Is that okay
Yes.
for you?
Yeah. Okay.
Yeah,
The diagnosis here is diverticulum. The results
diverticulum.
for the results for the examination is diverticulum, urethral diverticulum. It's a pouch.
Mm, yeah. This one we will need to do some. You have to have infections. We have to treat the infections, and we will inform your care will be under the group of specialists, include our consultant and physiotherapist, support group and counselors. In this, we will treat all the infections. There should be no infection. We will ask you to improve your lifestyle, maintain your weight, uh, and this will need a surgery.
Hmm.
Uh,
Surgery, it can't be treated without surgery.
well, it depends upon the symptoms and depends upon the size also.
Mm.
And if the symptoms are bothering you frequently or it is increasing the size and not responding to the conservative management, then we may have to do a surgery.
Yeah.
I think I will discuss the case for case with the consultant and come back to you. And for now, I give
Mhm.
you information leaflet to know more about this diverticulum, and I will
Okay.
fix an appointment with the consultant. Is that okay with you?
Yeah. Thank you.
Thanks for your time.
Okay. So, Arena, what's your name? Arena, isn't it? Or
Aina, this is Aina.
Aina, Aina, Aina. Okay. Um, Aina, we will start from the history. You take 8 minutes in the history. 8 minutes. The history must be within 3 to 4 minutes maximum. maximum. So try. The history was brilliant, but you take long time, very long time. You mention everything, but in long time. The examination was okay, but during the examination, you must mention also after the examination the investigation that you may need. But I give you the diagnosis because there is no time. So after the examination, you may need to request some investigation, which will be the urine sample. You may need some images to diagnose such like a cystogram, MRI, balloon double ureterogram, camera cystoscopy. Could need a cystoscopy or for these, or also could you could need a urodynamic in just in case if it associated with other complication or with other problems. Okay, the investigation here is very very important, but because you don't have enough time, you shorten it the answer. So the management will be in the MDT. It is a specialist doctor. It is a team of doctors from different specialties. It will be urogyne. Sometimes we need the general gynecologist and urogynecologist as well in these with a special nurse, because we may need to use after operation, we may need to need a special nurse for the catheterization and self caring for these catheterization. The treatment will be according to the size, as you mentioned. If it is small size, so you don't need any surgery, she will take antibiotic and she will take painkiller and pelvic muscle exercise for these. Maybe it help, and you will give her. However, if it's irritant and if it's large enough, we will do a surgery, and of course we will not do a surgery. The urogyne will do the surgery. It could be the surgery from outside from the vagina or from the inside from the urethra to remove this pouch and resuture it again. It's a special technique. We will not mention it here in part 3. We don't need to know about it more. However, when you in this case, in all cases, whatever you mention surgery directly, you must also mention the complication that the patient could happen, because it is a patient safety. The patient must know that this surgery, if I do a surgery, I have a complication, because he want to decide to accept the surgery or not, isn't it? Okay, so with the complication, you must mention that there is complication like could be infection, there is a stitches, there is a pain, could be a bleeding at the surgery. After the surgery, she may have a narrowing in the water pipe, recurrence urine infection, leaking after that. This infection can lead to the renal problem in addition to the fistula could happen. Moreover, it can be recurrent again. So all these complications must be mentioned after you said you may need a surgery. Surgery means complication, it must be at the same time. If you want points, it must be like this. The history was okay, but it was very, very, very long. So try to shorten it, try to be faster. Everything is okay. Okay, so also you must mention if not treated, there will be a recurrent UTI, maybe there is a stone, maybe there is inflammation, could happen mechanical or others, abscess formation, incontinence, and fistula could happen. So when you mention the treatment, you must mention the treatment with the complication. If there is no treatment, what is the complication that could happen? Okay, another thing I want to hear, everything is important in the 10 minutes. So I prefer to say that I will give you a written information in a state of leaflet, and the written information, it is better to be at the beginning. When you give, can I ask you a few questions before we start? Can I ask you a few questions before I explain the management plan to you? And at the end of our session, I will give you some information leaflets regarding these. Here you take the points. Sometimes when you explain, like here, you take long time in the history and you don't have to mention the leaflet at the end, okay, at least you have tick for these and you take the mark of that. So from the beginning, give some points that you collect the marks. You know it is a game and you must success in this game. Is it clear? Do you have any question? Is there is anyone
Thank
to
you. Oh,
had a feedback or
uh,
question?
thanks very much for giving me the opportunity and the feedback. I want to know how I can improve on the history. Is there, I
Okay.
asked some
Look, yes.
unrelevant questions.
So, look, I will let you the history here, and I will. Uh, we will see how many minutes it take. Okay. Okay.
Okay.
Sarah Roberts. She will answer yes. So now, first of all, I will let you know. Make a 3 minutes or 4 minutes, and try to do the history with yourself, without waiting for the answer. Like now, look. Hello, Sarah Roberts. Yeah, I'm Dr. Samar Salman. I'm one of the doctor here in the clinic. Just to confirm your age, please. As you know, my consultant is away, and he sent me sorry, my consultant is away, and I'm in a state of home. Is it fine for you to be with this meeting with you? She will answer yes. So I understand from your notes, from your GP referral letter, that you have lump down below, and you are suffering from it more than 3 weeks, and you are here today to know the management plan to you. Is that right? Yes. Can you tell me, do you have any other concern you want to discuss? Can I ask you a few questions before we start the management plan? And at the end of our session, I will give you some leaflet, written information. Is that fine for you? Yes. So can you tell me more about your complaint? How long you have been suffering from it? Is it associated with pain? Is there any vaginal discharge? Is there any burning sense? Is there any burning during passing urine? Is there any water? How about your water work? How about your bowel work? Do you have a partner right now? Yeah. How long you have been with him? I'm sorry for asking these questions. I know talking about sex is something embarrassing. So can you tell me if there is any problem during sexual act? How about your period? Is it regular? Is there is any bleeding between periods? Is there is any abnormal bleeding you want to mention? What do you use for the contraception? How about your pap smear? Okay, so now you cover everything in this area, so you will go. I realize that you have 2 kids by vaginal delivery. Do you have any problem during delivery and pregnancies? Do you have any medical disease? Any medication you take? Are you allergic to any? Do you have any surgery before? Sorry for asking these questions. Do you smoke? Do you drink alcohol? Any recreational drug? So in your family, do you have any concern you want to add? I know some women who suffering the same problem. They have some of them they may have a loss of interest, anxiety. Some of them they have depression. So do you have any of these symptoms? No. Thank you for sharing all this information. Now exactly 3 minutes, and we finish the history. Try to do like that. Try to do like that. When you in the exam, adding 1 minute the answer, they will answer you directly no, 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 no. Okay, but take your time in the history in the beginning before the medical, before the you ask about, when you ask about the medical, do you have any medical problem, directly do you take any medication, directly you take, do you have allergy? When you ask about smoking, if she say yes, ask her to quit. Drinking, ask her to quit. When anyone tell you yes, I take recreational drug, especially there is a case in antiphospholipid syndrome. This is who she lose the baby and postmortem results. She will tell you yes, I take cocaine. Directly ask her, did you share the needle? Because when she say yes, I share needle, that means there is a sexual infection disease other than the other problem. So you must mention it, because cocaine by itself can lead to abortion. So even okay, So, do you understand me? Do you have any question?
Ma'am, I have a question.
Oh,
Yeah?
thanks, ma'am. Thanks.
Yes.
Ma'am, like here in the question it is written she wants incision. So like the management of options for urethral diverticulum is like de-roofing. So can de-roofing be incision?
Yes.
Like I
Look,
can
if you
say,
have,
okay,
yeah,
I'll do de-roofing for you.
the yes, the management, yes, you can. If you have time, the management here, according to the size. If the size is small, so it just observation, antibiotic, and pelvic floor muscle exercise. But if the size is a little bit larger than 3 centimeter, so it can be lead to the surgery. But you will not do the surgery. There is the urogyne with the consultant of gynecology. Both of them they will do the surgery. And you mention here is the surgery will be whether from the vaginal route and whether from the inside. Okay. So wait, please.
Hello.
Okay, so you must mention this as well. Okay, if the surgery, so don't give a details because there is no time. This is a lay examiner. Okay, so it's
So ma'am,
most
like which
important.
route the surgery is, like it is only vaginal or
It
is
was
there any other
no,
route?
no. It could be vaginal and it could be from side the urethra, from inside to remove the
Okay.
pouch, and after that resuturing again. There is a technique for it, but I don't think so. It's important to know this technique. You
Okay.
don't have a
So
time for that.
okay, so you mean to say it's like either vaginal route or urethral route, right?
Yes, from inside the urethra to remove it, or from outside, according to the route and according to the condition. This could be after all the investigation by camera investigation, cystoscopy and cystourethropy, and also you have MRI for these to know the pouch, the depth of the pouch, if there is fistula inside it or if there is no fistula inside it, if there is abscess inside it or no abscess inside it. You understand all these. So not you are not the one who will decide this. You will give her another appointment with the consultant to decide if she needs a surgery or not. But you must mention it. Maybe the consultant will discuss with you the surgery and the complication of the surgery. This is important than the way and the procedure how you do the surgery.
Okay. So ma'am, like
Okay,
one, yes ma'am. Like
what
ma'am,
is it?
can you share the slides of the first question answers in the group?
I will share the video.
Okay, thank you, ma'am.
So you
Hello.
will see all these.
Okay, thank
Hello.
Thank you all of you. I think it is 1 hour. Maybe we need later on before the exam more than these, but I will try to choose the most difficult and the most questions that can come in the exam, especially such of these subjects come in May and last November. And we will try to cover most of the new cases which need to know it more in depth and how. Thank you for all. If you have any questions, please
Hello.
in the Telegram and we
Ma'am.
will answer you.
Yeah, ma'am,
you.
I have one question. Hello.
Yes. Hello.
Uh, uh, yeah, ma'am, the choice of surgery in case of urethral diverticulum is the diverticulectomy. Then how will we explain the diverticulectomy in layman language?
Yeah, in layman language, you will tell her there are lump at the beginning part of the outer passage of the urine, and this pouch could be happened because of the relaxed muscle or because of the weakness of the muscle. And if this pouch happened and this lump happened, it can be a stagnation and the urine will be can't pass urine effectively. So when the urine be side, it can be there is recurrent of infection or stone formation, or thus make the irritant pain for her. So you can't tell her like that. It is a lump in the
Uh,
last part of the outer passage of the urine.
Okay. And ma'am, treatment is diverticulectomy. Will we explain diverticulectomy to the patient?
Yeah, you tell her that it's a lump, as I told you, in the urethra. But you must tell her the outer passage of the urine because she don't know what is the urethra. You know, because it is online, so it's difficult to draw to her. But in general, if it's face to face, you must draw it to her so she can understand it very well. That's why I put here picture. This is to you. This picture not present in the exam. In the exam he will tell you, after you mention the examination and after you mention the investigation you request, after you say the investigation he will give you the results. Because you are online, so the second page or the third page, it will be the results of the investigation. So he will tell you that we request this investigation, we examine her, and we find the blah blah blah. We request investigation, and at the end we find blah blah blah. So according to that, when you speak with the patient, you will tell her according to the information in front of me. That's, you don't tell her the examination. According to the information in front of me, you have what we call it urethral diverticulum. You hear about it before? She will say no. You must explain it to her.
Okay. Thank you, ma'am. Thank you
Thank
very
you.
much.
Thank you all.